So I'm happy and very proud to mention, Israel is in the midst of a war that began on October 7th, and there's been a tremendous amount of stress in the population. Many people have been displaced from their homes. People, family members of soldiers, of people who've been involved in the warfare. 2 days after the war started, we established an online psychotherapy treatment so that you can come to us virtually, and we will see you 3 or 4 times over the internet on a Zoom, and it's called Dados, and give you psychological first aid, as it were, to help you get through these very difficult times. So that's one thing that we did, and we did it. Made this happen very quickly. Further to what you were just saying about the workforce, and I'm going to broaden that to the entire population. Digital therapeutics is an important field that, if you're talking about looking into the future, people who are severely psychiatrically ill do need to see psychiatrists, mental health professionals. But there are many of us who maybe are not doing so well, stressed out, having difficulty sleeping. Might be able to do reasonably well with digital therapeutics that can be web-based and administered to an entire population, therefore bypassing, at least for the less severe cases, allowing them to get the help that they need, allowing us to treat the more severely mentally ill who do need us face-to-face in the more traditional setup. So these are also things that are being done. We're also applying a technology developed by a company called Gray Matters, which has developed based on fMRI data, but we looked to see what on the EEG correlated to the MRI, and we're basically doing neurofeedback, using that technology. We have data that is now impressed that it's good for PTSD. It's now actually been FDA approved. We're now moving on to administer this for other disorders, and particularly PTSD, patients coming into PTSD now related to the recent war. This is also something that we've been working on. And then finally, we're developing also EMA, ecological momentary assessment, for patients who are inside the hospital wards. And this means that a couple of times a day, you get on your cell phone just a couple of questions that you have to answer, which will help us monitor what's happening with you on an ongoing way. Because, generally in psychiatric hospitals, the doctor will see the patient a couple of times a week, the nurse, etc. But here we're having something that's ongoing. And these are all examples of how we're administering technology in our day-to-day work, and we're continuing to expand this. All of these things are being accompanied by research. So we're going to be assessing and publishing this stuff over the years to come.